Hey everyone, welcome back. It's Dr. Marcus with the Arthritis Solution, and I want to talk to you about what we do here at our practice, Provolution Health, as part of the Arthritis Solution. And a number of questions I get both when people come into the practice, when they call up the practice or email us at the practice or message us on Facebook. The questions are fairly thematic, meaning there is certain things they want to know and understand, and the number one thing that we often get asked and people want to know and understand is, okay, what does the Arthritis Solution journey actually look like? What is expected of me? What is necessary in order to bring about that result? So I just wanted to talk about some of those elements to give you some insight and to have an understanding of how we are different and how that difference is going to actually materialize in incredible results for you. So let me begin with the process. Let's just say you either call up the practice and come into Provolution Health and you make an appointment to see me here in the practice or one of my incredible team. So the first thing that will happen is we will do a history, and this is commonplace. And if you go to a doctor, you expect somebody to take a history and to do an examination. So we're going to ask you about what you're experiencing. Is there some pain or dysfunction? Was there any previous trauma? What brought about your pain, your arthritic or degenerative condition? How you're experiencing that? What that experience means for you? How it's impacting your health, your quality of life? How it's limiting your mobility or freedom or independence? And then we'll dive deep into some other elements through the examination process of, what type of impact is it having on your mobility? We'll do range of motion testing. We'll check, does the joint move through its full and natural range of motion? Is it tender to touch? Is it inflamed? Is it swollen? And then by investigating both your history and that examination process, we've got a reasonable understanding of whether or not you have an arthritic or degenerative condition, what impact it is having on you and what its causes were, and what level of progressive degeneration that is present. But of course, what you don't want to do is say, okay, here's your arthritic degenerative condition. We know what you've got now. Here, try this. Let's see what happens. I want you to stop. I want you to hear this. Did you hear those words? If a doctor, practitioner, any healthcare practitioner says to you, well, let's try this and see what happens, get up, walk out. Why? That's a speculation, a guess in relation to what's happening with your health. If they say, let's see what happens, they're going to try something, and it may or may not succeed, it may or may not be effective, and therefore it may or may not provide the necessary results and give you the outcomes that you want. That is because they don't know whether it's going to work. Well, what we do is we then go off and do the necessary testing, whether it's x-rays, whether it's MRI, whether it's blood tests. We utilize the history and the examination to identify whether we can help you, whether we believe you have an arthritic or degenerative condition, and whether we have enough information to move forward with a recommendation. But without objective findings, without the necessary tests that confirm the level of degeneration or the presence of degeneration or even the type of degenerative process and the extent of inflammation, without that information, I cannot give you my best recommendation nor the most accurate recommendation. So we send off for the necessary testing. And that could even include heart rate variability to find out whether your nervous system is non-adaptive and limiting your healing response. So there's a whole series of tests that we do. Then we come back, we review those tests together. You and I, we analyze those tests. I don't just read a report and say, yeah, you've got arthritis. Off you go, here, take some pain-killing medication and an anti-inflammatory. We don't do that. What we now have with that information is, here's the level of arthritic and degenerative change. This is the type of arthritis that you have. Here's some of the other factors that are involved. And I go through and I show you your x-rays. You get a visual representation. We take the report and we interpret that, making it in English instead of medical speak, and we equip and empower and educate you to know what's happening in your body, why it's happening, and then what you can do about that. Then we go through our recommendations, which may be an entire lifestyle change. It can incorporate chiropractic care on a consistent and regular basis to break the pattern of pain, inflammation, and damage. There will be likelihood of supplement changes to reduce the swelling, inflammation, and for trigger a healing and regenerative response. There will be lifestyle sessions such as exercise, diet, nutrition, emotional well-being principles. We will look at your lifestyle and we will structure an individualized and personal care program for you specific to your arthritic and degenerative presentation based on objective findings so that we know exactly what is happening. Then we know exactly what we need to do to support you in the direction that you want to go. So it's a comprehensive and complete approach. It's a fully detailed assessment with a fully detailed individualized care plan to make certain that you go in the right direction, and we are not going to guess We test so we don't have to guess. We're not going to say, try this and see what happens, because we know the information that we've researched through the process and how that is going to respond to the care that we deliver. We can give you an absolutely accurate representation of what is going to happen and what choices you need to make and what actions you need to take to bring about the results that you're after, that we know together that we can get. So hopefully that answers some questions, but it really needs to take place here in the office. So please give me a call, join us at Provolution Health, and we want you to have your own personalised arthritis solution.